Good evening, everyone. I'm Stacie Crain. I'm the director of telehealth, and my favorite thing in the whole world is implementations because, as amazing as telehealth is, really it's the customizing of it and the getting into the nooks and crannies and kind of meeting people where they're at and knowing what their priorities are that really kind of lights a fire in my team and kind of what we do. So, and Dr. Kamra, I'll be interested to hear how you do implementations too. Really, what I've found works very well is to do a whole pre-telemed assessment, really with the facility, with the partner site, with the clinic. Outpatients, that type of thing. So we really look at who's going to be involved in this. Who is this meaningful for? Sometimes even bringing in customers. So what does this look like for you if you're at home? We want to the ability to get healthcare to be as common as getting a meal. Like if I need a doctor, I can find one. It's not a gigantic challenge. We're trying to kind of eke healthcare into the nooks and crannies of everybody's life, so to speak. So we look at who are the stakeholders and then what is the need, because the need is frequently different. Maybe it's like Dr. Scari was saying, maybe it's, holy cow, we don't have enough intensivists for the amount of COVID patients that we have right now. And maybe it's, we just can't get enough subspecialties. Like we're rural, we're small, we can't have cardiology and infectious disease and pulmonary and pediatrics and neurology. So the needs can be very different depending on where we're working. So we look at kind of what that is and then sometimes do a site visit or really look at the clinical and current operational workflows. Again, ensuring that telemedicine is really a custom fit. It's not like, here's telemedicine, log in, see a doctor, but it really works the way people want it to work. So it's useful, right? If we don't want you to have that kitchen tool that just sits in the drawer, like that's not helpful. So looking at the workflow review and how we integrate telemedicine and having more providers integrated in that. And then also looking at what equipment is available. So what kind of equipment, what cameras, what speakers, what broadband, all of those things have to be taken into consideration as well to ensure that the provider and the consumer can connect. So we look at what kind of metrics. So what is important as far as quality? What is the number one thing, the number two thing, the number three thing that you want to see? So is it connection time? Is it better outcomes? As Ed was saying, is it, we need to save some costs or our readmission rate is skyrocketing? What are the number 1, 2, and 3 things that we really, really want to drill down on focus? So 3, 6 months, 12 months from now, we're really looking at like good data. Like, are we making a difference in what's important to our partners? So once we kind of get all that squared away and we find out like, how can we customize this for you? Then we really do a big kickoff, kind of a welcome party. So anybody that is a stakeholder in this, we want their input. We want to know, how do you work? What is this going to look like for you? What kind of stumbling blocks can you see? Like let's get those all out of the way early and work again to make sure that this is usable. So we start drafting design. And this is so much fun again, you guys, because it's custom. So we start design drafting. We go back and forth, back and forth. What about this here? When should we call there? Can we call sooner? Absolutely. So we start working on dashboards and workflows and refining those with our partner sites. And that's where we really get to know each other well. We really kind of get into the nitty gritty of how this is going to work best. So after that, after kind of the stakeholders do all the nitty gritty, then we socialize the program. So we want everybody and their brother to basically know telemedicine is coming. So it's not a surprise. I mean, we joke over here, but like we're really serious. We want housekeeping to know it's coming. We want cafeteria staff to know it. We want everybody to know like what this card is with a physician face on it that's rolling through. So we really socialize the program and then we go live. So it's not ever meant to be a surprise. It's meant to be something that's looked forward to, like we are getting more healthcare. Like that healthcare is coming to us. It's going to fit in the nooks and crannies. It's going to fit where we don't have providers. It's going to allow us to care for more people. However that looks, it should be an exciting thing when it gets there.